Let's do this. So let's see if we can do this efficiently. What's the first lead I'm going to look at? Anybody remember what I did before? And it should be negative, and it's a limb lead. AV R. Does that look negative or positive to you? Good, and that's normal. So it should look negative. It should be negative. Because we're looking at a vector of the heart that's further away from the mean QRS vector in a normal heart anyway. So we're happy about this. Lead 1. Is that positive or negative? Good, normal for that. Lead AVF. And that's good. So we have no axis deviation. So here's your leads. You have lead 1, 2, and 3 sampled. Those are the 3 bipolar leads. And then the other 3 limb leads are AVR, augmented right, AVL, augmented left, and AVF, augmented down to the foot. And which electrode do we use in the legs, right or left? Only. That's correct. Very good. So all of these are your axial leads, frontal leads, limb leads. Then we have all samples now of your precordial or horizontal or transverse or chest leads. V1, V2, V3, V4, V5, and V6. So in the limb leads, we checked for axis. Now we're going to check for rotation. V1, is it negative or positive? Yeah, I see. V2, is it negative or positive? 3 is positive. So the transition from negative to positive happened in this EKG between V2 and V3. And then it continues to be positive V4, V5, and V6.
Isn't V4 through V6 negative?
No, it's positive. Yeah, looking here, right?
So where do you have like that transition?
Between V2 and V3, which is not normal. So where's the transition supposed to be? V3 and V4. V3 and V4, right? So it happened early. And if you remember before, V1 and V2 are looking more right side of the heart, anterior, right side of the heart, where V3 and V4 are also anterior, but they're septal. V5 and V6 is looking at the left side of the heart.
And like you're looking at the deflection, right?
Yeah.
Okay.
So baseline, anything above the baseline, R wave especially,
Okay.
is positive, and then the below the baseline is negative. Q and S technically are the negative waves. Very good. So now we have the lead 2 drawn out on the bottom because that's the one we want to see. And take a look at this. There's one in your book. I think it's slightly different. So you want to find out, and always left to right, is it regular rhythm? That's not always the first thing, but we're going to get rhythm soon. So let's make sure that each one of these QRS complexes, which is a heartbeat depolarization prior to systole, is coming right where we expect it to come. And then we can say it's regular. So technically the RR interval will be the same between every one of the R waves in this. So this is lead 2. And, yeah, it's good. And then you look for P waves and make sure they're normal P waves, sexy P waves. And the PR interval is normal at every beat, followed by a normal QRS at every beat. So it should be P, QRS, normal PR interval between 0.12 and 0.2 seconds for the PR interval. The QRS interval or duration should be less than 0.11 seconds. Not even really looking at the T wave much for a while. And this is just the same EKG on top. Get practice with the PowerPoint, and then there's that lead 2 again. So you could do heart rate. This is a good one here. So let's do the heart rate. Starting there, that's the 3rd beat, close to the line, which makes it easier for me. So it's 300, 150, 100, and then 75. It's closer to 75. I think there's 18 little boxes between these R waves that's regular. So it should be about 83 beats per minute if you did the math. So that falls normal, right? Between 60 and 100 beats per minute ventricular. So we have a good P wave, normal QRS, and normal PR interval all the way through. And we could be pretty comfortable calling this what? What does NSR stand for? Normal sinus rhythm. And where's the cadence starting? Where's the action potential starting? At the sinoatrial node. Very good. Here's some other inserts. Lead 2, of course. Lead AVR was negative, which is good. Lead AVL isoelectric, which is fine. Now the planes, again, we went through this before. This is something we should go over all the time. Transverse, also known as what? Horizontal. Correct. This is the chest leads or precordial leads. And how many of them? Are there? There's 6, and there's the V's. You'll see where to put them closer up. 3, sorry. V4, V5, and V6. So what is V5 and V6 looking at? What part of the heart? Left, yeah, left ventricle, yeah. Very good. V1 and V2, what are we looking at? Very good. And this is in the horizontal plane. And here we're going to look for abnormalities like rotation, right? Rightward rotation or leftward rotation, right, Kevin?
Yeah.
And then frontal, and we're not even going to look at sagittal here. We just look at the 2 different planes. Frontal is also known as axial. Right, and these are your lib leads. How many limb leads were there? Anybody remember? There's 6, so they add up to 12. Lead EKG, 6. So you have the bipolar leads, which are lead 1, 2, and 3. And your augmented unipolar leads are AVR, AVL, and AVF. Just to get the memorization down. So this is more like a clock, right? With the middle of the clock being the SA node. And you're going to see the frontal plane, mostly superior and lateral, inferior, more of a face of a clock, hexaxial diagram. So which one is this over here on the left? Is that axial or is that transverse? Excellent, excellent. Axial. This is like a clock. It's got 30 degrees between each lead, like we saw before. Always draw the arrows, I told you. And like lead 1, put a positive there so you know. Put a negative on the other side. Draw the heart, the thickness of the left ventricular wall. And I mentioned mean QRS vector. And this big red line, I didn't say it before because I really wanted to introduce it in another picture, but that big red arrow in the middle there is your mean QRS vector in a normal heart. And it falls between lead 1 and lead AVF. Probably about 45 degrees. Lead 2 is about 60 degrees in the hexaxial diagram. So this is good. They show the planes. They show how the chest leads come out forward towards the anterior. And the frontal plane is the clock, is this.
What's difference between the bipolar?
Well, it's the direction of the vector. Like lead 1, 2, and 3. I feel like Dubin explains it really good with the Einthoven's triangle, how they can be manipulated to 2, and they augmented 1 unidirectional based on where the bipolar leads are. So you really don't have to know like how they're bipolar, but you should remember that 1, 2, and 3 are the bipolar leads, and the augmented ones are unipolar around those bipolar leads. This is kind of good here because you could see the heart. You can see great vessels. You can see where everything is. And later on, you'll see a picture which actually has the intercostal spaces. So again, remember these leads. You could draw this, always practice, put the SA node right there, because that's the junction. And all the time in this lab, we're talking about ventricular axis, ventricular rotation, really. We're going to go over the mean P vector in another lab. So today we're talking about the mean QRS, and QRS is ventricular depolarization. So again, draw that, draw the SA node, draw the arrows as best you can. And sometimes it's not perfect. And you can see where they have that transition. And what's the best lead to look at in the chest leads?
It's one that goes down.
V5 in the chest leads. In the axial leads, the limb leads, what's the best one to look at? Lead 2, very good. You should know that, and it kind of helps you along. And don't forget about the simple stuff, like basically was on today's quiz, like, you know, for the limb leads, there's 6 leads, but there's only 4 electrodes. And technically, you're only using 3 of those electrodes to see a vector. 6 leads, I'm sorry, chest leads are straight up 6 leads, 6 electrodes. So you'll see these are the electrodes that we're putting on the chest here. And we'll go through that placement again. So always put the positive signs. I like putting the positive signs in there to what you're actually looking at. And then the negative would, you know, we'd have to draw these lines out and put negatives all in the back. There's a good picture of that coming up too. So here we are. We're right on the actual patient. And you're putting the chest leads on. You can put it on the limb leads first if you like. Oh, I'm sorry, electrodes. I see. I knew I was going to say that. So you don't have to memorize the colors of these electrodes. They do have colors that correspond. And if you really come and look at these machines and the electrode clips, they all tell you. It's going to say RL for left right arm. It's going to say LL for left leg, so forth, so on with the V. So that's kind of helpful. So you really should take a look at that before you do it, because we're going to do it eventually. Okay. And then this is standard because it's actually on the limbs. Right? Modified, we put up here that midclavicular line, second intercostal space for the upper limb leads, and down here, inferior medial to the anterior superior iliac spine. Okay, so this guy has a standard 12 lead EKG electrode placement on it. And here's his results. So what do we look at first?
Wait, for those 6 leads, those are modified too or not?
No, nothing's modified on him.
I know, but for like the V1 through V6, like would you modify it?
No, I'm sorry. It's just for limb leads.
Okay.
Kevin, yeah, good question. Yeah, there's never a modification. Like if we were going to do stress tests, we do modified limb leads and put them on the chest and the abdomen because you'd be tripping over the wires, you're trying to take blood pressure and pulse ox at the same time. So the chest leads are pretty much left alone. I mean, the wires are a hindrance, but they kind of go under the shirt and you can keep them out of the way, which you can see. So that's true, yeah. So AVR, is it positive or negative? Good. Is that normal? Yeah, that's normal. Everything's going to be normal on this EKG. And then we look at lead 1. Is that positive? It is. Lead AVF. This one might be hard to see. Yeah, it's positive. So that's good. So you have 2 thumbs up, right? Lead 1, positive. Lead AVF, positive. So that's normal axis. So this side, the left side of your viewing screen is your limb leads, your axial leads, looking for axis. Frontal plane. So now let's look for rotation. And you say normal axis, you don't say normal axis deviation, right? And rotation, you just say normal, you can say normal rotation, that sounds okay. So let's take a look. V1 is supposed to be negative, and it is. V2, negative, and it is. V3 is negative, but V4, if you count the boxes, is positive. So you have a transition from negative to positive between V3 and V4. Is that normal? Yeah, that's a normal area of transition going across to the left side, which all should be positive from V4 to V6. And here, this is what you have to memorize a bit. Where exactly do these electrodes go in the chest or precordial leads? So we start at the 4th intercostal space on the right. This is the only one that goes on the right side of the heart. Okay, V2 is even with it, except on the left side. And you'll see better pictures coming up. Again, fourth intercostal space. And then I put lead V4, which is midclavicular line, which again, right through the clavicle and the nipple on the male. Fifth intercostal space. And then I take V3 and I split the difference between V2 and V4 and try to get it on soft tissue if you can. V5, anterior axillary line. So it's between the armpit and the mid-clavicular line. V6 is kind of deep in the mid-axillary line. But these are in a straight row. V4, V5, and V6 basically run in a straight row on or near the fifth intercostal space to the mid-axillary line. So yeah, you're gonna have to remember those. Rotation. So here's Einthoven's triangle, which is based on the 3 bipolar leads. So if you look at this, I really like this drawing this. I like to make sure you know the SA note is there. Draw plus signs and negative signs for the leads, like lead 2, lead 1, negatives, right? And then positive electrode and positive vector, really, for lead 3, so forth, so on, AVR, negative, positive, AVL, positive up here. Remember, for most of these pictures, we use arrowheads as the positive, the direction of the vector, because that's what you're really looking at, the part of the heart you're looking at. So Einthoven's triangle based on the 3 bipolar leads. So lead 1 goes from his left side of the heart to, I'm sorry, right side of the heart to the left. So where is the positive electrode? It can only be these 3.
The left arm.
That's correct. So right arm, it could be, and they have lead 1 is left arm and left foot or left leg. So we don't use this one. That's green for ground. It's a ground. Here's the negative electrode for lead 1. Right arm. Lead 2, inferior lead. So lead 1 was a lateral lead. Lead 2 is an inferior lead going down to the left. So what's the positive electrode for lead 2? Left leg, very good. And the negative electrode? Good. And the opposite direction is lead 3. So lead 2 and lead 3 are both inferior leads. So what's the negative electrode for lead 3? Left arm, and the right, and sorry, the left foot would be the positive electrode or left leg. So you can split the difference here, and this is where the augmented leads are. This is pretty good because it shows you, right? AVR. I like arrows. Negative electrode here. AVL, negative electrode, and an arrow. So it shows you the positive electrodes. AVL is the left arm, AVR is the right arm. And it's tough to get the negatives for these. And this is AVF here. So if I asked you what was the negative electrode for AVR, you have to say between the left arm and the left leg. You have to do this in your book, so I'm just going to tell you what the answer is. AVL would be left leg, the negative electrode would be between left leg and right arm, never the right leg.
Also, like, can you think of it as like, if the side that's going to be negative is like if it's AVR or AVF or AVL, then like the right arm will not be negative.
Yeah, for this one you can.
Will not be negative.
Yeah, for these augmented leads, that makes sense to me, for sure.
Like the R is positive, the L is positive.
Yeah. So you draw the arrows, the plus signs, and have fun with it. And then you could do lead 2 coming in here, lead 1 here, and lead 3 here. And there's 30 degrees between these. Okay, and I'll get a better picture without me making a messy drawing. So this is, I told you this before, I really like this one because it has everything. It's got the heart. It's got all the degrees, negatives on top, the 30 degrees between each vector. You have what you're looking at with a camera, which is perfect. And again, you should draw the arrows, put the plus signs on all of them, and then the negatives too. Because that's the way you're going to learn it, by doing this repetitive. So this nice big arrow is called what? No, it's from the FSA node. That's where it starts. But what is the arrow called? What's the vector? Mean, right? QRS vector. This is really important. And that's a normal. That's a normal vector. It looks like it's about 45 degrees. But look how close it is to lead 1 and lead AVF. So what plane am I looking at? Is this limb leads or chest leads? But this whole thing.
Limb leads.
Yeah, that's you can't take that for granted. You really have to stay on that because it gets away. So, so the mean QRS vector is in a nice place. So lead 1, is it going to be positive or negative based on where these depolarizations are? Yeah, and so will AVF. So all these little black lines and arrows are all the different vectors within the myocardium, everywhere, especially ventricles. And the mean QRS is the average of all of them, where most of them are going. I keep saying this over and over, that depolarization will go towards hypertrophy, towards the muscle myocardium thickest, and away from infarction. So this is a really good picture to show you all these things. And you can look at the degrees. And now you can see why, if the mean QRS vector is somewhere else, you're going to have a problem. Like, what if the mean QRS vector is here? That line, the nice rainbow vector moved over here between 120 and 150 positive. What would happen to lead 1? Would it stay positive? No, that's right. It would go away from it. So lead 1 would be negative. Now, what about AVF? That would be positive. And if you remember from before, if you memorized, but you should know that this is going towards the right side of the heart. I even moved it to the right side of the heart. So this is RAD, right? Right axis deviation. Negative lead 1, positive lead AVF. What if it was up here above negative 30? Lead 1 could still be positive, right?
It would be negative, right?
Lead 1 would be positive because it's close. Proximity. Don't worry about the numbers. Yeah, that was a good one, but don't worry about the numbers. Look where the mean QRS vector is in relation to the leads. So it's still close to lead 1, so it's going to be positive. Yeah, the numbers are just so you can see where it is. It's not going to be negative or positive as far as the deflection. So lead AVF is really far away from here, right? So that's going to be negative. Then you're going to have left axis deviation. Because obviously it went to the left upper quadrant too. And that kind of simplifies it a little bit. Now, if it goes up in here, complete opposite of where it should be, then you have what's called extreme right axis deviation. And that would be lead 1 would be negative and lead AVF would be negative. And like I said, you can memorize that, but you should really understand why. And you can never get enough of this. Just making sure you know. We're not using the sagittal. Transverse is the same as horizontal. And this is the chest leads or precordial leads, V1 through V6. Frontal is axial plane. And here we're using the limb leads. And there's 6 limb leads, only 4 electrodes though. And we only use 3 of them. So keep repeating that. Just take the simplest stuff first and work your way out to by the time we get to arrhythmias. This is good too, because it shows you, again, the actual intercostal spaces on both of these diagrams. And this one shows the heart, which is really good, and where the electrodes are placed. They do have colors, but you don't have to memorize those. Just memorize the limb electrodes, clips. So all of the chest leads are positive anterior. They're all positive in the front of the heart or towards the front. So the negative leads are all in the back. That's all it is. That makes it a lot simpler than the axial leads. Okay. And remember, V1, V2 belongs more to what part of the heart, right or left? V3,
Right.
V4 is, we could say septal. I mean, there is anterior there too, but let's just for this class so you know where we're going, that V3, V4 is septal, and that's where the transition should happen. V3 should be negative deflections. V4 should be positive. And then what are we looking at V5, V6? the left side, right? And it's going to be a positive QRS because that's where we're looking at, where the most of the myocardium is. And that's where the closer to the mean QRS vector.
Oh, okay. Cool.
The same thing basically here. This is cool because they show you the view. I like the view here, like it's because it's a horizontal view, like you can cut them in half. Like Dubin has a good picture of the guy actually cut in half, I think. I haven't looked at it in 6 years, but I know that picture stays in my head. It helps me with the horizontal plane. Like if we put a big slicer right in the middle of this guy from top to bottom, and you're looking down at the heart. So the mean QRS vector is always like right in here. So this is why V5 is such a good lead to look at in the horizontal plane. And the transition, again, right here. And these are pretty typical waves. V5, V6 is left, V3, V4, more septal. And these are also anterior. And you get some posterior view too. If you really want to know, you can see there's really good videos like on the NCLEX review, and they'll show you like exactly where they're looking at. Like some of V1, V2 can see posterior part of the heart too. So you get a really good view between the axial leads and the horizontal leads, 12 different vectors and views of the heart. So you can find out if anything is happening as far as depolarization, because if you don't have depolarization, it means something is wrong. And you're not going to have a good systole. Yeah.
For chest leads, can like artifacts happen too?
Sure. Yeah, I think that's a good, I think like an artifact, in fact, like if you, artifact, like like it's like everything. That's a good question to think about. Think about what that means. Because if you're, especially in the chest leads, because if you're laughing, right, or you're hiccuping, or you're talking, breathing heavy, then you're going to be depolarizing everything. So yeah, and so the artifact should be in every lead, technically. Yeah. In that area, like here's a good point. I know we're going way ahead right here, but everybody knows the T wave. We don't talk a lot about the T wave, correct? But if you have anybody know from like AMP2, if you have a really tall T wave, what could that signify?
Myocardial infarction.
No, T wave. T wave, a really high T wave, like a massive T wave. Hyperkalemia, very good. Good memory. So hyperkalemia, and the K, what does the K stand for? Potassium, right? So anything with emia at the end is blood. So of course, it's not the big T wave is not just going to be in lead 2. It's in the blood, so it's going to be in every lead. The big T wave, right? So that's kind of a good question that he asked. That makes me think of, it depends on something that's systemically going on.
Right, or like deep breathing.
Yeah, it could be deep breathing that's causing that artifact, right? Hiccuping. I always say hiccuping. So this is kind of complicated, but you should know this. I mentioned this before. And this is just the ventricles, remember? But of course, we know there's an SA node and an atrial depolarization, and those cells will fire a cadence of automaticity. Then the SA node, the AV node, bundle of His, and the bundle branches. So the depolarization always starts from the endocardium and goes to the epicardium, everywhere. So if you kind of see that, if you take a general look at all these, it's going from inner to outer. And you'll see a subendocardial myocardial infarction versus a transmural myocardial infarction. Transmural means through the whole wall. And of course, that's more damaging. But this is pretty cool. One thing about this I like, it shows you that at this point in depolarization, it hasn't reached this thickness yet. So you might get that little negative Q wave there. And you don't have to have a negative Q wave. You don't have to have a Q wave at all for it to be normal. Like I mentioned before, if it's excessive size amplitude of a Q wave, that could signify an old myocardial infarction, possible scar tissue. Yeah. So then it goes downward, and this is the best part, because now right here, lead 2, and this is all lead 2, by the way. So that's where you get that nice upright R wave that starts to go downward as the depolarization goes upward and outward. Endocardium to the epicardium, and then goes upward because the blood pumps up, right? We want the muscles to contract after depolarizing upward. And you get that little S wave, which is bigger than the Q wave. Both Q and S are negative waves. this is all lead 2 down on the bottom. And the purple line, the purple arrow, is all the mean QRS vector changing. So this is what we like. This is where we want to live. This is what we want to see in lead 2. We don't want to see this. That means the QRS vector has completely turned 180 degrees.
What is a vector?
What is vector? Vector is something that has direction and amplitude.
Okay.
So it's about the direction, showing you the direction of the vector of depolarization from negative to positive, right? Because positive is sodium, positive is depolarization. So the negative would be the opposite.
I have a question now, but like.
And the amplitude is like the size of the depolarization where we want it.
So then like, but you know, how it's like the recording electrode is the one where it's like that has the positive like electrode towards it, like for like the deflections or whatever. Then how does that connect to that?
The positive electrode is where you're looking at. So that's where the sodium is going. That's where the machine is picking up that depolarization.
Okay.
Thanks to Einthoven.
And so the vector is just like that is also that.
Is the direction. Yeah, like the mean QRS vector is the biggest vector. It's a mean of all the other vectors. So the vector has the direction. Really, it's about direction mostly.
Okay. Cool.
A vector, like where it's carrying something. You know.
And then what's it looking for? Like direction?
It's looking for depolarization. It's looking for the membranes of the cardiomyocytes to be depolarized.
Oh, like of the Na plus and stuff.
Yeah, sodium influx, right?
Okay, cool. Okay.
And then you'd also see sodium outflow by repolarization.
Got it.
So it's showing the electricity through those vectors and the amplitude of those vectors. Like I don't want to confuse you, but you see this mean QRS vector?
Yeah.
What do you expect AVR to look like? I mentioned this before too.
Well, AVR is supposed to be negative like
On a normal, and this one it would be negative. Like AVR here would be negative. It would look like this. But over here, it might be positive. It will be positive, right? Because we're looking at lead 2, but AVR is the complete opposite.
right.
Positive electrodes in the right arm.
Right. It's supposed to be.
So this would be positive. Remember, that's the first thing I looked at. When I looked at that EKG today, that's the first thing I looked at to make sure AVR was negative. So now the amplitude is high in that vector because the vectors, that direction of that vector is going right towards that positive electrode
Okay.
and away from this one, which is the one we really want it to go towards.
Right. Okay.
Left leg, right? Left leg in the lead 2. So this is all this is showing. Like if it moves a little bit, you still got a positive, but it's smaller. Yeah, I mean, even in a normal axis heart, your QRS is fine being at this amplitude. You know, your R wave anyway, or QRS. You don't really have to have a Q or an S, really. You really don't. Okay, and this is isoelectric, so kind of in between, halfway. And this is how we plot the perpendicular line, and you draw an angle and get the number. But all I showed you to do is right lead 1,
Yeah.
and lead AVF, normal axis.
Yeah.
Lead 1, lead AVF, left axis deviation.
Okay.
Lead 1, lead AVF, right axis deviation. Lead 1, AVF, extreme axis deviation, extreme right axis deviation. And that's the limb leads, hexaxial.
Okay. Great.
So here it is. Here it is, right? What I'm talking about. And you can memorize the angles, which really is helpful. You know, these numbers are negative. It's just filling out 360 degrees with split in half. So again, AV node, ventricles, draw it. Left ventricular wall, mean QRS vector. And then put where the leads are. Like this would happen to be lead 2. And this is the positive electrode. Where's the negative? Up here. AVR, positive. And so forth, so on. Just go through all of that. Lead 1, positive. Put an arrowhead. Put a positive. Put a negative.
Isn't AVR supposed to be positive by the right arm and then negative by the left?
Which one?
AVR, like, isn't the like the
AVR
left arm-
is positive on the right arm,
right.
but the negative electrode is kind of between the left arm and the left leg. So if you said both, you'd be okay. But I probably don't ask you that. But the book does. Like you have to fill that out.
Right. Also nice.
So, yeah, so if you can remember this, I'm recording, so if you remember, if you're asked for the negative electrode for like AVR, it's between the left arm and the left leg. If you're asked for the negative electrode for AVL, it's between the right arm and the left leg, right?
Got it.
Not that important, it really isn't, but the book asks you, so I want you to, because that's something that's gonna come up, so what, and you'll get confused, so hopefully you'll remember.
I have a question.
Sure,
How does that work with like only 4 electrodes?
well, that's what the machine does, right? The machine
Oh, okay.
bases it on the bipolar lead. So it's really 3 electrodes and 3, that's Einthoven's triangle, right? It's all based on this miraculous thing.
Okay,
I
got
figured
it.
out. I think that guy was a musician too. Like physics was like a hobby, right? And he just figured out, and he figured out like the rhythm of the heart. He did a lot of stuff, this guy. And Dewar doesn't even tell you half the things. Pretty interesting. So I mentioned this before, you can get a little leeway for the horizontal heart, which tends to be more left directional, not necessarily left axis deviation, LAD. But we're going to live here, right? I told you this. We're going to live between lead 1 and AVF. And this is where we want the mean QRS vector to be. About, what was it, about 45 degrees plus?
Okay.
And down here, there's 20 degree leeway here for the vertical heart. That's important to know. So if the mean QRS vector is here, you have right axis deviation, RAD, right? So it means it's further away from lead 1, so that'd be negative, but not so far away from lead AVF, and that'd be positive. So right axis deviation, never do it up. Lead 1 negative, lead AVF positive, right axis deviation. If it's up in here, outside the leeway, of course, it's closer to lead 1 and it will be positive. So that's positive, but lead AVF, look how far away this is to the AVF. So lead AVF would be negative, and that's LAD, left axis deviation. And the worst case scenario being up here, and this is far away from both of those leads, lead 1 and AVF, so both of them are negative for an extreme right axis deviation.
Okay, that's bad.
So remember this though, this is all axial. This is all frontal leads. These are limb leads. We're not talking about rotation, is all about the horizontal leads.
Get back to rotation is that.
So this is only, axis has to do with the frontal leads, the limb leads. And that's all this is about right here. And here's the chart you can memorize. If that helps you, just memorize this. And then you do it over and over. Let's look at this whole thing. Lead AVR, is it negative or positive? And these are just the limb leads, right? This is just the limb leads. Negative, good, normal. Lead 1, lead AVF. So what do we have here? What do we have here?
That's negative.
So it's closer to lead 1, further away from AVF. So it's drifting off to the left, right? Up into the left upper quadrant. Correct? Minus 30 or less.
But it's like the P waves are positive.
No, we're not. We're looking at QRS. We're not looking at any atrial stuff at all today.
Always.
Yeah, that's a great question. But we're just looking at QRSs here.
Okay.
Yeah, but next time when we do arrhythmias, we're going to look at the mean P vector, a cute little vector in the atrium. But we're not talking about that now. We're just looking at QRS. That's okay. That's how we learn. So, but again, you could memorize this, but understanding it really goes a long way. And then doing the drop line thing would be great too. But again, do we have the time for that? And we're going to mess it up. We'll spend half a lab just learn how to cut the paper. So just remember the thumbs and these leads for axis. Limb leads. And here, skip page 53. Don't even look at, rip it out of your book. I don't care. But forget about these things, these pages here too. Okay, so now we're talking about something different now, ladies and gentlemen. Now we're in the horizontal plane. Now we're talking about transverse plane. Now we're talking about precordial plane or precordial electrodes. We're talking V1 through V6, totally different game now. Now we're looking for rotation. Is it leftward or is it rightward? Okay, and that has to do with where the transition is. So if the transition goes from negative to positive here, between these two, would that be rightward rotation or leftward? What are these two looking at, V1, V2?
Right.
So that would be rightward rotation.
Okay.
Now, if these stay negative, and we saw this before, if the transition happens between 4 and 5, which way is the
Oh, that's
Kevin?
not- That's not normal.
leftward rotation, right? That would be leftward rotation. If V4 was negative and V5 was positive, that would be leftward rotation. There's a couple of good examples at the back of this. And I kind of like this down here. You don't have to worry about this. This is, again, just looking up somebody's chest cavity if they're laying supine from the feet. So again, transitional zone, negative to positive, V3 and V4. And this is a good one too, because it shows you the actual right side septal, anterior, and left. So left, V5, V6, right, V1, V2 we're looking at. And septal, V3, V4. Bundle branch blocks, I mentioned this before. Like if this is a right bundle branch block. So the two ventricles are depolarizing at different times. So you get this little, this always happens with that stupid link. The R prime, there's two different rabbit ears, right? Rabbit ears I mentioned before. So that's the rabbit ears, dichrotic R wave. Over here in this one, it's a little different, but you can see the R prime. This is normal. Yeah, that's normal. So this one is in V6. So is that the right bundle branch block or the left? V6, V6, V6.
Left.
Left, yeah. This one's in V1. So is that right bundle branch block or left?
Right.
Very good. Very, 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 very good. So let's read an EKG. I know it's got some circles on there, but what the heck? So let's look at AVR. That one's a tough one to see, but it could be positive, yeah.
Whoa.
You know, if I count boxes, it kind of looks, maybe it's a little more negative. Okay, not very good for us, but something is wrong. Now this is lead 1. Is that positive or negative?
Negative.
Negative, negatory. And this one here, let's look at this beat in AVF. Yeah, so we have
Positive.
negative lead 1, positive lead AVF. That's right rotation or axis deviation?
Right axis.
know.
deviation.
Right, because that's a limb lead. Very good. I almost missed that one. I probably miss it every time. So now let's look at rotation. And you were worried about heart rate before this class. V1, it only shows you 3 of the leads, first 3. So it's positive right off the bat.
Right.
It's supposed to be negative. And this is the right side heart. So this is rightward rotation for sure. So we're looking at a possible, because of this bundle branch block, we could have a possible rightward rotation, and maybe not yet. It's coming. And hypertrophy. So V2 has this is really good rabbit here. See that? RR prime. And it's in V2. Wascally rabbit. And that V2 is what? Right side or left side? So you have yourself here a right bundle branch block. An RBBB. RBBB. So here's another crazy looking one here. AVR is good. Let's send them home. No, not yet. Let's keep looking. And now we have lead 1 looks positive, but something doesn't look right about that R wave, right? It's not tombstone, but it's something's wrong there. AVF.
Oh, wait, is the ST breast?
In lead 1, let's look at lead 2. It could be, yeah, we could have a subendocardial myocardial infarction, a possible ischemia, or cardiac tamponade. But what do you have in AVF?
In AVF, we have a weird.
Is it positive or negative? That's all.
I think it's negative.
Yeah, I think more negative too.
Wait,
I agree.
What's that top thing?
I agree, it's
Oh,
negative.
that's the S. And
So lead 1 is up, lead AVF is down. What do we have?
that's
axis,
rotation.
deviation,
Deviation.
deviation, be careful.
Okay. Okay.
Can't say it enough. So let's go over, look for rotation. Uh-oh, negative, that's good. Really negative. The amplitude of these things. V3 negative, V4 negative. So the transitions between V4 and V5, which is positive. So this is leftward, what? Rotation, because we're in the chest lead. It's good. Outstanding. So now let's take a closer look. Nurse Nava definitely noticed some possible ST depression, but let's look at this. This is really throwing me here.
Wait, but yeah, and there's ST elevation in AV in the one.
Yeah, sometimes you get a reciprocating elevation and
Oh,
depression
really?
in certain hearts. Yeah. So what is this one right here?
That's depressed.
No. Oh, yeah, that's true. That's true. But what about the R wave?
Oh, the R wave is like is messed up. There's a gravity.
Rabbit ears, RR prime, and it's in V6.
Okay.
So is it a left BBB or is it an RBBB? No, it's left. V6 is left side. Left side. Okay. There's your pages in Dubin. 191 to 198.
Also, what study is this?
What was what?
Which study are we on right now? What study is 7?
Oh, it's like in chapters. That's kind of confusing.
Not all of it.